What's going on? We're going to talk all things cold plunging. So we're going to talk about the history of cold plunging, some of the benefits of cold plunging, how you can hold cold plunge at home, who should and should not cold plunge, and everything that we need to know in order to do it safely and effectively. So let's talk about the history of cold plunging. Now, this is something that's gained a lot of notoriety in the media in recent years for all of its amazing benefits, but it's not actually a new technique or a new phenomenon. Cold plunging has been around since about 3500 BC. It was used by the ancient Romans, the ancient Egyptians, and the ancient Greeks for a lot of different therapies. It's actually been something that's had research done on it in 17 and 1800s, so it's something that we've known about for a very long time. But because of its notoriety in the last couple years, we're actually starting to do a lot more research and learning a lot about the science. So we're going to break down some of the benefits that research has started to actually come out with and show, so we know who really should be cold plunging. One of the first benefits that we're going to see from cold plunging is what's called vasoconstriction. So when we go into cold temperatures, the body needs to regulate its heat, right? So we can't lose all of that heat or we're going to end up getting hypothermia and dying, right? So one of the first responses that's going to happen when we get into that cold water is a vasoconstriction response. This means that all those little capillaries and blood vessels at the surface of the skin, at the arms, legs, hands, feet, things like that, are going to start to constrict, which is going to push all of that blood flow back into the body. It's going to keep that blood supply circulating where the temperature of the body is warmer. The other thing that this is going to do is it's going to drive a lot of that blood flow to our internal organs, things like the liver, the kidney, the heart, the digestive tract. It's going to help fuel and feed those organs. So if we're dealing with a lot of issues with liver, kidney, heart, digestive issues, things like that, we're going to actually start to just drive that blood supply there to help improve the function of those different systems. One of the other things that we're going to see is an acute stress response. So we talk about stress a lot being a negative thing, and when we talk about negative effects of stress, we're talking about chronic stress, and that's that fight or flight that just doesn't go away, right? So we wake up every morning and we think about the 1,000 things that we have to do. We've got issues with family, with work, all that stuff. That stress just never leaves us. And so that chronic stress has negative adaptation responses. The acute stress response is very helpful. We create a lot of positive benefits from that. Think of the acute stress response as going for a run or doing some weight training. We're going to create some muscle fatigue. We're going to create an inflammatory response. But when we stop the training over the course of the next hours to days, all of those things go back to normal and our body actually gets stronger as a result of that. So that acute stress response we get from cold plunging is very similar. What's going to happen as part of that response is we're going to cause an increase in cortisol production, which is our main stress hormone. That's the hormone that gets us up in the morning. It should increase in the morning and gradually come back down throughout the day. One of the most common things that we see in our office is actually dysregulated cortisol patterns, adrenal fatigue, things like this, especially in females. And this can cause a lot of hormonal issues, especially as you go through menopause. So for people who need to kind of use external sources to manipulate that cortisol level, cold plunging can be very beneficial for it because it is going to increase that cortisol in an acute manner. The other things that are going to happen is we're going to have an increase in our adrenaline hormones, norepinephrine and epinephrine. Now, norepinephrine is going to do a lot of different signaling things within the body that are going to have very positive effects. One of the big things is we're going to have a heightened focus and mental clarity afterwards. Now, this is twofold. We're going to have that increase in norepinephrine and epinephrine. That will create a heightened awareness and a heightened mental clarity response. The other thing is that vasoconstriction response. When all those arteries constrict and blood vessels constrict and pull that blood back into the body, cold plunging is one of the few things that can actually drive that blood supply into the head. So driving blood flow, driving oxygen, driving nutrients all up into the head is going to be very good for brain function. So there's kind of twofold things that are going to happen as a result of that stress response that are going to help heighten that sense of mental clarity and mental acuity and focus, which is why a lot of people like to cold plunge in the morning, just because it kind of gets their brain and their body going for the day. It gets that cortisol level up, it gets that energy level up, and makes you feel a lot kind of more clear throughout the day. The other thing that we can see as a response of that acute stress response, especially in men, is going to be an increase in testosterone. So instead of running out and getting testosterone injections and things like that, that can have a lot of negative side effects, if we can cold plunge on a regular basis, we can utilize that acute stress response for our benefit. That will actually help to modulate and regulate those testosterone levels in a normal way. One of the other things that acute stress response, specifically that norepinephrine response, is going to do is actually activate brown fat. Now, brown fat, unlike visceral fat or adipose tissue, is not a negative type of tissue. It's actually a very beneficial tissue type. And so we need to have that brown fat to kind of regulate our temperature. And actually, the more active the brown fat is within the body, the more our metabolism is going to increase, which means that having activated levels of brown fat can actually decrease visceral fat. Therefore, getting in the cold plunge on a regular basis can help you actually lose weight. So for a lot of people who struggle to lose weight, doing something like cold plunging, which is going to manipulate your physiology in a positive way, increase brown fat activation, we can actually help to speed up that weight loss process. Another really important benefit of that acute stress response is actually an immune system increase. So when we talk about the increases in the immune system that we see as a result of cold plunging, a lot of that has to do with our T lymphocytes. Now those cells are very important because those are the types of cells that are going to go after things like virally infected cells, like cancer cells, things like that. Specific cell types that we're going to increase are CD3 cells, which are just kind of our mature lymphocyte cells, our CD4 and our CD8 cells, which are T helper cells and T killer cells or killer T cells, and also T suppressor cells. Now, T suppressor cells is really important because T suppressor cells and T regulatory cells are implicated heavily in autoimmune conditions. So for a lot of our autoimmune patients, increasing that T suppressor cell function can actually have a very positive benefit on the activation of that immune response. So we need to kind of increase these cell types in a lot of our patients. I see decreased T lymphocytes in almost everybody who I test them on. So that chronic stress response depletes the immune system. Going into something like a cold plunge with that acute stress response can actually help increase and bring that immune system back online. One of the last things that we see is a very big increase in dopamine. So dopamine is our happy hormone. It can be an addictive hormone as well. Dopamine increases in things like eating a bunch of sugar. So a lot of times we feel sad, we feel depressed, and our body craves sugar. We're not actually craving sugar. What we're doing is our brain wants that increase in dopamine response, and we know that increasing sugar intake will do that. So if you're feeling sad, if you're feeling depressed, things like that, if you struggle with anxiety, those types of things, cold plunging can be amazing because it is actually going to increase that dopamine response. You may feel refreshed, replenished, a lot happier coming out. I personally like to cold plunge as kind of a way to just reset my day. So if I'm having kind of a rough day, if I don't feel that great, I'll jump in the cold plunge for 5 minutes, and when I come out, I'm like a brand new person. It's awesome. I love it. So I would definitely recommend cold plunging if you're dealing with anxiety and depression and that type of stuff, just because, again, we're going to be modulating those neurotransmitters in a really positive way. All right, so we talked about a lot of the benefits of cold plunging. Now let's talk about the how, so the specifics of cold plunging. So we should know there's a couple different types of cold plunging, which is really referred to as cold water immersion. So historically, a lot of times what people have done is they've done cold water swimming. And in a lot of Nordic countries, Scandinavian countries, what they'll do is they'll cut big holes in the ice, and they'll actually do swimming competitions and stuff for 4 or 5 months out of the year. And the science has shown that people who have undergone a whole season of cold water swimming, they've got decreased blood pressure, they've got decreased heart rate, they've got increased metabolic rate. So a lot of positive changes that they've seen in those cold water swimmers. So this is one of the easiest ways. It's also the cheapest way if you have access to getting in a cold lake or a cold pond. The other thing that you can do is buy a cold plunge, and there's tons of them on the market. You can just get simple bins. You can fill up your bathtub with ice. It doesn't have to be complicated. We've just got to get a vessel that we can then put ice in to cool it down. We've also got a lot of chillers and things that you can get that will circulate that cold water and keep it cold all the time, so you don't constantly have to buy ice, but that's going to start to increase that budget. So depending on what your budget is, where you live, what your access is to food and things like that, we kind of need to be able to modulate and kind of pick a cold plunge that's going to work for us. The cheapest thing to do that some people can do, some people can't, is cold showers. Now down here in Florida, we can't really do cold showers just because the water temperature doesn't get cold enough. Even in the winter time, like right now, that water is coming out of the faucet about 70 degrees. And we'll talk about in just a couple minutes what that temperature needs to be, but 70 degrees isn't quite cold enough. Now, what you can do for a lot of people up north is they can do those cold showers. They can go from a hot shower and then basically for the last minute of the shower, just crank it as cold as it can go. And if you're up north, if you're in a Scandinavian country, things like that, that water is coming out pretty cold out of the tap. So we can do that. All right, so let's talk specifics of cold plunging. How cold does the water need to be? How long do I need to do it? How often do I need to do it? And again, part of this is going to come to access. Now, if you don't have access to a cold plunge, just start somewhere. We just talked about how kind of the cold water coming out of the tap probably not going to be a big enough benefit. But if that's all you can do, then just start there, right? Because there's going to be some of those benefits. We're just not going to get all of them. So start where you can. If you have access to a cold lake, a cold pond, a cold plunge, then we're going to be a little bit better off as far as getting those benefits. What the research shows is that the water temperature needs to be somewhere in the ballpark of 50 to 58 degrees, and the research kind of conflicts. So what I do personally is I try to get that water below 50 degrees. Now, the research does not support that getting colder actually has an increase in benefits. All it does is reduce the amount of time that you can be in the cold plunge for. So don't feel like you have to go on Instagram and take a video of yourself in 32-degree water in order to kind of be getting those benefits. Getting in that 50-degree water is going to be just as good as getting in 38-degree water. Now, as far as total time per week, research is supporting that 11 minutes total per week is going to be the best kind of time frame. And that can be broken down a couple different ways. What I typically recommend is about 3 to 6 minutes at a time. Where we fall in that is going to depend on how cold that water is, what your cold tolerance is, and also how many times a week you want to do it. If you're doing it every single day, you don't need to do it for 6 minutes at a time because we're going to get way, way, way beyond that 11 minutes. If you're going to do it every day, 2 to 3 minutes at a time is going to get you a lot of those really good benefits. Now, as far as actually being in the cold plunge, a lot of people just put their legs in, they just put their hands in, they just go up to their waist, and you can do that and you'll still get a lot of the benefits. But one of the things that we talked about was brown fat activation and how that's going to help with weight loss, with increasing your thermogenesis, with increasing your metabolism. Brown fat lives kind of up here around the collarbones on the back of the neck. And so in order to get really the maximum benefits, what I always recommend is that you submerge yourself at least to the shoulder area here, trying to get those shoulders under the water. What a lot of people will notice is that they can adapt pretty well to the cold water, and the second that water hits this area, completely changes and they're freezing cold, right? So we want to get a lot of those benefits. The other thing that we have to keep in mind is that when you get in a cold bath, if the water's not circulating, you can get this thermal layer that forms around you where the water directly outside of your skin is going to heat up a little bit. And so you're not going to actually get as cold as if the water was circulating. So if you're in a bathtub, if you're in a cold plunge, it doesn't have that circulation effect. Moving your arms and legs around every couple seconds can help to kind of break that thermal layer. It's going to make it feel way, way, way colder, but it's also going to help get more of those benefits because the water directly touching your skin is not going to be heating up so much. Now, what should we be doing after a cold plunge? Now, one of the worst things that you can do is go straight from the cold plunge directly into a hot shower. The reason for that is we talked about some of those benefits are vasoconstriction. It's pulling all that blood supply into the internal organs. If we run straight into a hot shower, we're going to just pull all that blood supply back out to the extremities, and we're going to lose some of that effect. So what I always recommend is that if you're going to be cold plunging, if you get out of the cold plunge, as long as you have time for it, throw a robe on, throw some sweats on, walk around, and kind of warm up slowly for about 30 to 40 minutes. You can do some light walking, you can just hang out, it doesn't matter, but what I always recommend is let your body start to warm up slowly over the course of about 30 to 40 minutes before you go jump in a hot shower. The other thing that some people will notice is that after coming out of a cold plunge, they feel really cold, they start shivering, they feel a little bit worse. That's called the after draft. The reason for that, and we talked about how that vasoconstrictive effect is also partly to bring that blood supply inside the body so we don't drop our core temperature too much. What happens is as we start to warm up, that blood supply is going to go back out to those extremities, but your skin and your tissue on your extremities that was more directly exposed to the cold is much colder. So as that blood pumps through the arms and the legs, it's going to be getting cooled down and then coming back into the internal organs. And so we can actually see a drop in internal body temperature after the cold plunge because that blood flow starts to circulate. All right, so who should not be cold plunging? There's really only a couple populations of people that should not be cold plunging, and that's people with cardiovascular disease because that acute stress response can increase heart rate, it can shock some of those cardiovascular systems. We want to be very careful. Now, it doesn't mean you can't cold plunge at all. It just means you need to kind of consult with a doctor, consult with somebody first before you jump into any sort of cold water therapy. If you're going to start doing it, we need to make sure that we're starting off very slow so our body's not going to be shocked like that, jumping into that water. The other thing is some people with autoimmune conditions need to be careful. Now, cold plunging can be great for a lot of autoimmune conditions. It just really depends. So making sure to have a conversation with your doctor or your healthcare provider who's managing that autoimmune condition is very important, just to make sure that you don't get hurt. All right, awesome. So we talked about a lot of the benefits of cold water immersion, talked about how to do it, the different styles, who should and should not be doing it. So I hope you guys can take some of this information and go out and start bettering yourself. Now, my goal is to teach you guys the tools and resources that you need to be as healthy as possible, to make sure that you have all the information and the facts so that you can make informed decisions for your own health. So if you want to learn more about health-related topics, jump on, follow the channel, like and subscribe below. Make sure you jump in the comments, give me future feedback, things that you want to see in the future, and we'll make more videos and kind of dive into some of the research and science behind it.